Hello, I'm Mr. York, and today I'm with Dr. Ahmad, who is going to talk to us about his experience in working in the field of pharmacy. And I want to thank him so much for his time. And we're going to get started how we usually do, which is Dr. Ahmad, where did you go to school? Where'd you go to high school? And how'd you do?
Hi, Dr. York, Mr. York. It's good having you here, and thank you for the opportunity. I actually went to school at the Charter Oak District. I went to middle school at Royal Oak, then I went to high school at Charter Oak High School. So that was up to high school, and then after that, I did my undergraduate studies at UC Riverside and majored in biological sciences before choosing a path to go into pharmacy.
Very cool. When you were in high school, would you say you obviously went to UC Riverside and majored in biological studies. So that kind of says that you were a good student, but did you enjoy high school? Did you know that science was the way to go early on?
I was a good student because I knew the value of like my education, and I knew I needed to do well in school to enter a field that's kind of in a healthcare field that's a little more complicated. So they do require that you have good grades. I actually loved high school. I really enjoyed high school. I made great friends and met a lot of great teachers. So it was great going to the high school that I did and doing the things that I did. But definitely, it's a good path. And also, kind of answering the second part of your question, initially, I didn't know where I wanted to go in the healthcare field, but I did know I wanted to do healthcare. I wasn't sure if I wanted to go the dental route, pharmacy route, medicine route. So that kind of came later on.
Can you talk a little bit about the university and your experience there in the medical field? And then did going there, you think, help you get into your pharmacy school? Did they like that you went there?
So I actually thought the university was amazing. One of the things I that attracted me about that university, it's one of the newer universities as far as like how old some universities are. So a lot of the stuff was more up to date. A lot of technology was there. The campus was also very big. It was a huge campus. So it was nice to have that space and not feel crammed. Classrooms were pretty big, like your standard, typical, huge lecture halls, which I actually enjoyed. Typically that's something like you see in a movie, so it was kind of similar to that. Also, the major that I did, I enjoyed that major. Yes, it had its difficult times, but overall I thought it was a great program that they had. They have really good science programs there, and the school itself encourages us or the counselors to sort of pursue something beyond just a bachelor's degree. So I think the school overall was very ecstatic to know that I was going to pharmacy school.
Very cool. So I should probably take a little departure here and throw in some background information. The reason that I know Mutas is because I met you when you were working for Charter Oak Unified. Now, you came in as a science teacher, mostly or subbing for science, and that's when I met you. And I feel like that was in between your undergrad and your graduate work. Is that correct?
That's correct. I took time off between undergrad and pharmacy school. Part of it is I was trying to sort of hone in what I really wanted to do. As I said, they really push you to go beyond a bachelor's degree. And at the time, I wasn't really sure what path I wanted to take. But I also enjoyed teaching. So one of the things I wanted to do is go back and teach at my old district. So I did teach for a little while science and math, long-term subbing. And again, for the students here, that's how I met Mr. York. We sort of collaborated together, and he showed me a few things that he did in his classroom. And then after that, I went back to school just to kind of freshen up on some courses before going back to pharmacy school or starting pharmacy school.
Can you tell us a little bit about how difficult is it to get into pharmacy school? Are there a lot of pharmacy schools? Because from what we understand, there's only a few schools that actually have a pharmacy program. We've talked a lot about colleges recently and the fact that most colleges have a business program. In fact, it's one of the most popular majors, but not everybody has an actual pharmacy program. So can you talk about what made you choose the university you went to and how easy was that to get into?
So it is actually pretty competitive to go into pharmacy school. At the time that I went to school, there was only 9 pharmacy schools in California, and I didn't want to leave California just because I love it here, and I kind of also wanted to stay in Southern California. So I actually ended up going to USC School of Pharmacy. It is extremely competitive. They get at least 2,500 to 3,000 applicants for only 200 students per year. So there's only 200 seats per year, and the requirement is pretty high. So every student is required to have a bachelor's degree. And on top of that, every student is required to take specific science classes in their undergraduate studies and must have a specific cutoff for their GPA just on their undergraduate science classes. But the big key component is to keep yourself very competitive. One by grades wise and doing well in school, but the other one is extracurricular activities to really show that you stand out and that you're really interested in the profession. Obviously, doing things that are more related to the profession.
And that worked out for you because you're a, I don't know how to say it, you're a big fitness guy. Like you're very passionate about fitness and always have been. And I feel like that falls in line with the healthy lifestyle of working in the healthcare field. Yes.
Absolutely. Being in the fitness industry, which is what I was in, and kind of going working out and staying healthy, it is definitely more in line with healthcare. The big component that a lot of healthcare providers usually tell people is eat healthy, exercise to stay healthy, and that way you're on a lot less medications or less likely to be on medications. So that definitely stood out for me in my resume for school when I applied. It gave me something to talk about that a lot of other applicants didn't have to talk about, to show that I can also provide patients things that are non pharmacological therapy or things that don't require medication to sort of eliminate or reduce certain disease states.
Especially since the greatest cost to healthcare we always talk about is being unhealthy or living an unhealthy lifestyle. Do you want to talk real quick at this point before we actually get into grad school? Do you want to talk a little bit about your competition and some of your awards?
Sure. So while that time frame in between undergraduate and pharmacy school, I became sort of a little bit passionate about competing in fitness competitions. So I started sort of doing a little more research and digging more into it and sort of meeting people who've competed before, and I started competing myself. I did my very first bodybuilding show in 2008, where I placed in one category fourth place, the second one second place, and then 2009 and 2010 I actually placed first place in both of those. And then I took a year off and then started competing again while I was in pharmacy school, which kind of made me even more disciplined, and I did two more competitions, and in both 2011 and 2013, I got third place in both of those, also doing like bodybuilding competitions for my weight class.
To be interesting, you have to have interests. And certainly that was always fascinating to me to walk into school and see another person who was competing in that way and doing something very different. So it's very cool to hear that that helped you out when you were going into grad school. So you apply for pharmacy schools. Can you tell us real quick how many pharmacy schools did you apply to, how many you were accepted to, and what made you end up going to where you went?
So I applied to all the California schools. As I stated earlier, I wanted to try to stay local as much as possible, but I also applied to out of state schools. I applied to a school in New York, a school in Nevada, and a school in Utah. The schools that are outside of California, the difference is that some of them required what's called a PCAT, which is like an entry exam, sort of similar to the SATs that you take to try to get into undergrad. It's more or less a standard exam to see where you place relative to other students. I got accepted to almost all the schools in California, not as much on the ones outside of California, because they tend to like to accept students from their own state first.
Mhm.
And then I chose USC for one, the prestige of being USC, but two, after speaking to a lot of alumni, they tell you how important, as they call it, the Trojan family is after graduating, or when you get closer to graduating, to help you find something within the field of pharmacy that you may like, as far as connections or networking. So the networking is very, very important within any field, not just pharmacy, but specifically pharmacy because it's such a small knit community.
I mean, you talk about how competitive it is. How did you get in?
So for what the time when I applied, California schools were not requiring the entry exam. They were basing each student based on a few categories, GPA being the most weighted one. So again, to all your students, I'd say definitely focus on GPA because that's heavily weighted, both in high school and in undergrad. But they also looked at other things such as extracurricular activities and your major. Some interviewers like to see students that do things aside from being a health science major. They want to see that you're unique. So some students came in with economy or finance major, but took all the science classes that are required to get into pharmacy school because they wanted to show that they're diverse, they're different, and they also did a few other extracurricular activities, whether they play sports or volunteer work. As I stated earlier, it was difficult to get in, but I think what helped me personally is that I had a lot of things that I've done prior to applying, such as competing in fitness competitions, teaching, doing all these different things, tutoring. And so that kind of allowed me to stand out a little bit more because when you're applying to graduate schools, everybody has a very similar GPA. So they want to know what makes you a unique student versus somebody else who may have a similar GPA.
Do you want to talk about USC real quick? How long is the pharmacy program and what did you think of theirs? How tough was it? I can remember when you first started it, actually. We spoke once and you were talking about how intense it was.
Sure. So the actual program is a 4-year program. There are a few limited schools that have a 3-year program. And the reason theirs is a 3-year program because it goes all year round. There's no summer breaks. I kind of did not want that just because I wanted to have a little bit of a break for summer to kind of have it as a breather. But the actual curriculum is very intense. It's very crammed material because they have to teach you a lot of information. Although 4 years may seem like it's a lot, it's not as that much time to cram all that information in because 2 of those years are where you are on what's called your clinical rotations to sort of put your the information you learned into practice. So in reality, they only have about 2 to 2.5 years to give you all that information. So one of the things I would encourage or advise students is start to learn time management early on in your life because when you enter graduate schools, regardless of what it is, well, specifically healthcare, um, they give you a lot of classes and a lot of material in a short period of time. And it is on you if you want to succeed or not. It's on you to learn the material as much of it as you can or absorb as much of it as you can and be prepared for exams or when they do mock patient um, or patient and healthcare provider sort of samples to see where your information is at.
Because of all the material that you had to assimilate and to absorb, as you say, did you use a lot of study groups? Was there a lot of group work?
Yeah. So for me personally, I like to first study a little bit on my own to sort of learn the material. And then a lot of us would meet up in groups. We realized meeting up in groups is a lot more effective. The reason being is if I learned or absorbed certain amount of information and another person learned certain amount of information, we sort of share our thoughts and they may teach me something I don't know, I didn't pick up, or and I might teach them something they didn't pick up. So group studying was very, very helpful in sort of filling in the gaps of things that I might have not understood or might have missed.
So you get done with school, which I mean sounds amazing. That must have been the greatest moment to finally be done after 4 years of something that intense. How difficult did you find it to then find a job? And we haven't even asked, where are you working now?
So I'll answer the second part first. So currently, I work for City of Hope Medical Center, which is a cancer center, and that's where I'm currently working now. Going back to the other question about finding a job, this is where I kind of go back to what I discussed earlier. It is important to network and also develop that inner communication skills and personal skills. Part of being in the healthcare profession is not just knowing the information, but also meeting people and interacting with people and having good personal skills, because part of the job is dealing with patients with different personalities every single day. But you also have to learn to deal with other professionals as well. So it can be very difficult to find a job after work if you don't work on that component. Luckily for me and thankfully, I was able to meet the right kind of people and sort of network well and work and develop my personal skills, that when it came to the process of when we started interviewing for jobs, I was able to find a position 3 months before graduating. Obviously, not everybody's able to do that, but then again, it goes the importance of learning how to network and speak to others in a professional manner.
Speaking about personal skills, you're bilingual, yes?
Yes,
Do you feel like your employer really appreciates that? Do you get a chance to use it in your job?
absolutely. Regardless of where you end up working, being bilingual helps. So for me, I speak English and also speak Arabic, both languages fluently. So to kind of give your students a little bit of a background, prior to me working at the setting that I'm at, I used to work and still sort of work part time in a retail setting. And that helps a lot because sometimes you have patients who may not necessarily, their English may not be well spoken or broken up. So they feel when you speak their language or the same, whether even the same dialect of that language, it puts them at ease, especially when you're in healthcare, because they're already feeling sick and overwhelmed with whatever that they have. So to feel like somebody can relate to them and speak in their language puts them at ease and makes them feel better.
How long have you been actually working as a pharmacist? And then what do you think? Is it everything that you wanted it to be? Is this where you're going to be for the rest of your career? What do you think?
So definitely, I've been a pharmacist for 6 years now. It is everything that I thought it would be. But for the most part, it's a great profession. I love it. I don't think I would have wanted to do anything else for me personally. And one of the things I actually like about being a pharmacist, for any of the students who are interested, you are a true frontliner to most people, because especially when you do retail pharmacy, a lot of people may not necessarily be able to afford to go to a doctor or see a doctor right away. So a pharmacist is their first line to reach to ask for advice, for medical advice, for information. Again, that might put them at ease or might give them a remedy that they need without necessarily seeing a provider right away, or it gives them time until they are able to see a provider. So that's what I love about this profession. And the other thing too is it in our profession, you can always change paths even if you are midway through working in one area. So, for example, as I said, I was full time in retail and I wanted to sort of try something different. So now I'm working in a clinic with doctors and patients for, cancer patients. But I still do part time working in retail because I still love that component and interacting with people and seeing how happy they are when I give them information that they want.
When you say retail, do you mean like a CVS kind of an atmosphere or
Yes. So retail basically is being what we call a community pharmacist, in that you are working in the community where you have direct patient care contact. Whereas if you work, for example, as a hospital pharmacist or a clinic pharmacist, your point of care contact is predominantly the physicians and nurses. You may not necessarily interact directly with patients, or at least not that often. So that's usually what encompasses as retail setting or community setting.
is there anything next for you? Like, is there another level to get to? Do you have to go back to school for anything? What is the next plan for you? Or have you done everything and it's just now kind of just getting better and better as you work in the same capacity or similar?
That's actually a really good question. You can move up if you'd like. So there are a few people, especially some of my classmates, who choose to do what's called a residency after pharmacy school, which is typically 1 to 2 years to help them hone in on a specific type of training. So some people may do 1 or 2 year residency, for example, specializing in cardiology, which is like anything has to do with the heart. Or some people might specialize in oncology, which is anything has to do with cancer. It's not necessarily a requirement, but it does also make them more competitive for jobs because they have a subset of skills that other pharmacists may not necessarily have. For me personally, because I was able to start working at City of Hope. I was able to sort of build that skill set without having to do the residency. And I love what I do. And there's always room for growth. So, to answer the final part of your question, there's always room for growth. So, one thing I can do and I'm considering is becoming board certified in specializing in oncology. And that will allow me to grow even more within that path that I'm in.
Have you ever thought about going back and teaching? Or is there an
Yes.
opportunity for that?
I'd love to teach. So one way we, as pharmacists, are capable of teaching is we can become what's called a preceptor, where you can have students from pharmacy schools during their clinical rotations come rotate through our clinics. So I'm in the process of working with some of the local pharmacy schools, such as USC and Western University, to allow their students to rotate. So that gives me the opportunity to sort of teach them some of the things that I do. Usually each rotation is about 6 weeks, 6 to 8 weeks, and that allows me to sort of give them a flavor or taste of what I do to see if that's something they could be interested in.
So we really appreciate your time and you sharing with us today. Thank you so much, Dr. Ahmad, and thank you for joining us.
Thank you for the opportunity, Mr. York. I really appreciate this time, and I love to help any of the students. And even if any of them do have any more questions, please forward any of their questions to me, email me, and I'd love to answer their questions if they want anything more in depth.